I think we'll get started and allow the others to join us along the way. Thanks very much for your time this morning. The purpose of this webinar is to kind of dig into the measurement modeling tools that IBI provides and how we can work effectively with CBiz and your colleagues. We are recording this. As I said earlier, we're going to put it on your website so it can be shared internally. Let me start with some context, if I could. And the context is what we see going on out there with employers. And as we all know, the last year has been heavily focused on healthcare reform. But I think what we see now is somewhat of a transition from tactics around how do employers respond to healthcare reform to more strategic conversations at employers about what are we going to do to manage health and understand health outcomes. And that, I think, will be part and parcel to ongoing decisions of employers. I think to a great extent it's driven by the C-suite. They're looking for the value of any investments the organization makes, including health. And I think it really changes the conversation internally about why should we either continue with healthcare or invest in the health of the workforce. What do we get from that as a business? And I think we find from employers that they have finally come to the conclusion that trying to manage their different benefit programs, their group health, their disability, their workers' comp, their EAP, in these separate silos from a claims cost focus is just not the way to do it. It's really a dead end. And so they're looking for new strategies around a more integrated approach to population health management, not that the benefit programs in their management is going to go away or put under one umbrella, but it really is how do we start understanding the connections among the things. And I think the last thing we hear from employers all the time is, as I see this new and broader vision, I have to recognize that I have limited data, limited time, and limited money. So some of the things we'll talk about today directly respond to that issue for employers. So let's jump in. And this is the opening page of our website. And if you don't have a user ID and password, we can get you one because that gets you into some of the things we're going to talk about today. So as you log in, I'm already logged in, you'll see here the main tabs. We're going to focus on tools today. We're showing here on our main page the registration for our upcoming national forum. But today I want to focus on the tools part of what we do at IBI. And in dealing with the employer realities, what we've tried to do here at IBI is really respond to the key questions that we hear employers talk about. And certainly one of the questions we hear more and more from employers is around absence. They often don't know how much absence they have in their workforce and what it costs and what they do about it and how they compare. So what we've tried to do at IBI in responding to these questions is build modeling tools that do not rely on a great deal of data from the employer to start to put their arms around these things, and then also some measurement tools at the same time. So that first question we hear about is absence. And I'm going to touch on today the modeling tool that we've developed. We call it the absence cost estimator, and then our benchmarking program around lost time. Second area we're hearing from employers about is chronic health conditions and disease management. Now, it's not as if that's new, but I think what is new is the employer interest in broadening the conversation of, well, what else does chronic health influence and impact? And if I do a good job of managing it, what's the full benefit of those interventions and investments, particularly on the outcome side around absence and disability performance and productivity. So again, we'll talk this morning a little bit about our modeling tool. We call it the Health and Productivity Snapshot. And then our measurement tool that we call the HPQ Select, which is actually an employee survey, self-report survey around these dimensions of chronic health and productivity impacts. And then the final question we hear about is, well, as I think about healthcare reform, as I think about what we're going to do strategically in the future, I really need to understand the full impact of health in my workforce and what it really means to my business. You know, employers have typically focused on health as healthcare cost. As they broaden their perspectives, the question becomes, well, before I make a decision, I really want to better understand what health means to my business. In the modeling tool we've developed, we call the full cost estimator. So we're going to talk about these this morning and perhaps explore some of the ways that IBI can support CBiz and their clients in using these tools to drive broader and deeper engagements. So this is a screenshot of the tools section of the website. So back to that tab I showed you. If you click on that tab, this is what you see pop up. And as you can see here, we organize the landing page around the key questions and our key tools. So what we'll do is we'll explore these things today and focus first on absence, that first question that employers seem to have these days, which is, well, I haven't really paid a lot of attention to absence and lost time, but given the economic realities of the world, the slim profit margins, the fact that many employers have downsized and they actually need their employees to come to work every day and be healthy, absence has become a bigger deal. So the first question is, what are the implications of absence for my business? Because that question, I mean, imagine the CFO going to the VP of benefits or the HR director and saying, well, how much absence do we have? How often do our people not come to work? For the most part, that answer is, I don't know. And I think that answer is just not going to be acceptable going forward. And so what we've tried to do here with the absence cost estimator is develop a model that gives that person a starting point, a modeled outcome, if you will, to at least respond to what they would expect to see by way of absence in their business, even when they don't have all the data themselves. So the absence cost estimator, that first modeling tool we talked about, when you click on that, it looks like this. So some information about the tool, what it estimates, and then a simple online entry form. And this tool is an online tool that is available to all our members, both our supplier members and our employer members. And it simply picks up a couple of key pieces of information to generate these estimates. So as you can see here, it asks the industry sector the employer is in. The default is the U.S. workforce because we do quite a bit of analysis on the entire working population in the U.S. Drop-down menu to the high-level NAICS industry sector codes, the 2-digit level, but then it allows the user, if they want, they don't have to, but if they have more detail on the 3-digit or even 4-digit industry code the client is in or the employer is in, they can actually enter it in the website and really generate more detailed reports. The other two pieces of information is the headcount and the percent of full-time workers. So essentially, you really only need two pieces of information to run it, the high-level industry code and the number of employees. If the employer had more detail, particularly around percent full-time workers, we get a more precise estimate. But when the model runs, a very simple one-page report is generated. We've run the model on a manufacturing company, 2-digit SIC code, 7,560 employees, headcount, and 85% of the employees are full-time workers. So those are the inputs to the model. The model runs in the background, and this is what pops up on the screen. And it would tell us for this employer, or this kind of employer, the total cost of absence would be about $10.7 million. And then we give the two components of those costs, the wage replacement component, that is, employers do, in fact, for the most part, pay employees when they don't come to work because of health, sick leave, short-term disability, workers' comp disability, and the like. And there's the lost productivity component. That is to say, when employees don't come to work, there's a financial impact on the employer. Now, that financial impact may be associated with the employer having a larger workforce to make up for absence. The employer may use overtime, temporary help, or the employer may not be able to replace that employee and may suffer revenue consequences. Now, this estimate, this lost productivity estimate, when we model that, it is based on peer-reviewed research with 800 employers published in the economics peer-reviewed literature. So we're just not making up a lost productivity number through a simple formula. It's quite sophisticated underneath this, and it is associated with both industry and occupation. And then finally, the effective wages and benefits per lost workday, $278. So we translate it back to workdays. And the other piece of the report simply is reporting total lost workdays and then lost workdays per FTE. So essentially, with a couple of key pieces of information, you can provide for clients an initial overview of, for a company in your industry, the typical results around absence and the cost look like this. So we found that it's a very nice way to begin a new conversation with an employer that is becoming interested in absence. And it's a way to do it that is not data intensive, it doesn't cost anything, and it actually pops up right on the screen. Does that any question? Go ahead.
Yeah. Do you have anything that outlines the components of wage replacement and lost productivity outside of what you had just, obviously you rattled them off to us, but that actually outlines them?
Yes, we have a technical appendix document that goes with this that outlines where the data come from and the like. So on the one hand, we want to have, clean reports, but on the other hand, we want to have, appendix material that gets into those details. Because I think when people see something like this, they want to make sure there's real data and real science behind it.
I agree.
So let's go to the second part of the conversation around absence that we hear about, which is, well, how do I compare as an employer that provides perhaps short-term disability, long-term disability, workers' comp, family medical leave? I want to see how I compare within my industry, because that starts to give me a good sense of the opportunities I may have to make improvements. So one of the things that we do at IBI is benchmark those lost time programs, STD, LTD, workers' comp, and family medical leave. And we can do that because we've built a very large database, because these companies, these claims administrators, provide to us claims-level data on a large share of their book of business. And what this has allowed us to do is create a database of about 52,000 employers, actually 52,400 employers, based on almost 4.4 million claims. And so you see here on the screen simply the number of employers, the number of claims, and the number of industries for which we have benchmarking reports for these 4 benefit programs. So it allows us to build these really big databases and provide the best comparisons that are really available to employers on how their programs might compare or what's going on in their industry at this level. The program focuses on a number of dimensions: incidents of claims, lost time duration in the programs, claims costs, and then there's some contextual information around plan design for STD and LTD, geographic location, and diagnoses. So let me show you kind of what it looks like from the standpoint of a user like CBiz. CBiz is an IBI charter member, and what that means is you have access. Not all our members have access to this benchmarking information, but our charter and stakeholder members have online access, which is why it's so important to have a user ID and password to get into this. But when we click on benchmarking from our tools menu, this is what pops up, and I want to direct your attention right here because it allows you first to enter the year that you're interested in. We have 3 years of data online at all times. So in this case, 2010, 11, and 12. It allows you to say, I want to get an industry summary. Then it allows you to select the program you're interested in. So in this case, I selected short-term disability, but we also, as I say, have LTD, workers' comp, and FML along with STD. And then it allows you to select the industry group that you're interested in generating a benchmarking report for. Now, once you select one of these groups, it takes you to a menu which allows you to essentially drill down within that industry to finer details. We have, as I mentioned, something like 890 individual benchmarking reports online, sometimes 3-digit SIC codes, 4-digit, but it shows you right in the menu once you click on a broad industry what's available at the 2-digit level. If you click on that, it'll show you what details available because it's built hierarchically. So it allows you to get almost instant access to a benchmarking report for a client in a particular industry for a particular program. You could even do this in the client's office and download the report. And those reports look like this, and I'll use STD as an example. So we organize the benchmarking reports by basic questions that employers have. So oftentimes the employers say, well, how often do employees use this program? So as you see here, a number of different metrics that really help answer that question. But for each of those metrics, we have a number of different statistics to draw upon. Obviously, people are most used to thinking about averages or mean values. And so that's the first thing we always show. So in this case, the new claims per 100 covered lives, the group average, and this is for all employers in the database, is 6.2. But we also show right next to the average the group median value, and that is the value that divides the population in half. It's what you might say, well, it's the 50th percentile. And it's important to show these two together because averages are influenced by outliers, whether they're very expensive or long cases or very short cases, inexpensive cases. They do influence the average value. The median value, the middle of the distribution, the 50th percentile, is not so influenced by either large cases or small cases. So oftentimes we want to allow the user to decide, do I want to talk about the mean result or do I want to talk about the median? At the same time, we want to show more information about the distribution, the percentiles. So, for example, we show here the 10th percentile of 1.2. And that would simply mean that about, 98.8% of the employers have higher values than that. At the 90th percentile, 11.8 claims per 100 lives, only 10% of the employers would have values higher than that. So oftentimes the percentiles are useful in helping the employer kind of understand what proportion of the employers have higher values or lower values. For each metric, we always show the number of employers that go into the calculation because credibility really matters a lot, and the number of employers and the number of claims that go into the calculation obviously are very important in the credibility that the measure has. So we organize the reports in this way. When we work with an employer and get data from the employer, there is an additional column at the front which is the employer's results, so they can see how they compare in all these dimensions. Now, one of the key things, if you're working in these programs and you're working with employers, and let's say that employer wants to actually compare their experience to their industry, it is not unlikely that we already have that employer in our database if that employer is serviced by one of those 13 companies that I showed you a couple slides back. So one of the things our consulting firm and broker firms often do is say to the employer, who is your claims administrator in that program you're interested in? And let's go to that claims administrator if they're part of the IBI data consortium and see if your data are in the database. Now, in our database, we have an employer ID number that's provided by the claims administrator. We do not have an employer name, and we do that for confidentiality purposes. But what we want to make sure is if the employer wants a benchmarking report, they could, capture their own data or get whatever reports they get from their claims administrator and give it to us. Now, there's a charge for that service by IBI to the employer, or through your relationship with the employer, perhaps those data are available and we can generate a benchmarking report from the database itself. So if you're working with employers in STD, LTD, workers' comp, or family medical leave, one of the things you want to ask them is who's your claims administrator, and then come to us and see if we might be able to generate a report directly for that employer. The second part, again, the same question structure here. It's around lost time, and then information on return to work. But all the reports have the same basic structure: a list of metrics, the average value, the median, the percentiles, etc. Now, as I said earlier, in STD and LTD, we have additional information around plan design. Obviously, employers, when they think about making changes to their program, they often think about plan design. So in those reports, we have plan design information around the elimination period and the duration of benefits. And we actually use the claims data to develop a typology of plans based on the data themselves, which is a combination of the two. So you can quickly see in an industry what's typical, how many employers have different types of plans, so you can help that client understand what's going on in their industry around plan design. And in fact, we also have information on the same metrics you saw earlier by plan design. And I don't bring them in here in the webinar, but that is also part of the report itself. So you can start to see how these metrics that we mention here actually look different by plan design type. And again, it's a way to engage the employer in discussing if plan design is something they might like to look at in changing, and there's some information about results by plan design in the underlying data. And then finally is information on diagnoses. We do this at the major diagnostic level, MDC, but we show the percent of closed claims during the year and payments and lost calendar days. So the other piece that employers often want to know about is around diagnosis and what is typical, what they're trying to manage, and what other employers in the industry might be able to do by way of these outcomes with diagnosis. So this is all available to you folks and your colleagues online on any of these programs real time. That second area that I talked about, chronic health, and it's becoming, I think, a bigger and bigger factor for employers as there is literature and discussion in the trade press and elsewhere about the impact of disease management. So what we've tried to do here is really answer the question, what are the broader implications of chronic health conditions for my company from the employer's perspective? Now, oftentimes employers certainly haven't connected chronic health to outcomes like absence and performance and productivity, but this is a way for them to start thinking about the implications of chronic health on those dimensions without, again, having to invest a lot of time and a lot of money pulling data and trying to integrate it to get even an initial view of what that issue might look like. And that's why we've built models, is because it's really kind of a chicken and the egg. What employers tend not to want to do is spend a lot of money to see if there's a problem. So I think it's a way to help an employer start to gauge, is there something here that really is worth investigating without having to do that on the front end. And that's what models are particularly useful for. So again, we'll go back to that part of the website in the tools section, Health and Productivity Snapshot. Give some information. There are, for each of the tools, instructions and methodology, kind of back to the earlier point, that you can actually get access to. And here's the data collection piece. Now, when you use the tool, then you start working with us directly. This is not an online tool because it's too complex to build it online. It's very cumbersome to try to build an online tool with this level of sophistication. So what happens is we work with you to get the necessary data. Again, you start to see the industry information, the 3 different levels that we can get. We certainly do need the basic industry because all this is very tied to industry the employer's in, and the head count. And as you see here, if we had just these 2 pieces of information, we can run this model. Now, with that said, if the employer or their partner, CBIZ in this case, was able to give us additional information around things like percent full-time workers, wage replacement payments, percent of the employees with paid sick days, some demographic information, occupational information. The model is more precise, if you will. You're going to get a better estimate for that individual employer. So we always want to start at the broadest level, but we also want to give the opportunity for the user to give us more information and get a better estimate from the model. So once we run the model, this is the kind of report that comes out that we provide to you to provide to your client. Now, in this tool, we will always, if you desire, to be part of a conference call with you and the client and us to talk about the report, what's in it, how it was derived. We don't expect our members to be experts on models and the like, so we want to be there to help explain what's underneath it and what the outcomes look like. So, for example, we provide in the report distribution by the number of chronic health conditions they would expect in their workforce. So in this case, only about a quarter of this workforce based on these underlying data. And this model is run on a database of about 150,000 employee self-reports from the HPQ self-report tool, which was developed by Ron Kessler at Harvard Medical School. So it starts to give the employer a sense of what they might see in their workforce around the distribution of chronic health. It also provides information on the percent of people that we would expect, given the underlying data, to actually be currently treated for those chronic health conditions. So as you can see here, it's often the case that employees are not treated for their chronic health conditions, particularly those that tend to be of the more symptomatic variety. In Dr. Kessler's work, he has a very broad view of chronic health that includes not only the traditional diagnoses like cancer and heart disease and diabetes and the like, but also conditions that are more symptomatic like depression, fatigue, sleeping problems, because these are issues that often drive lost productivity, and employers often don't think about them. Then we give some breakdown actually by individual chronic health condition relative to treatment. And what is interesting is when you often see, let's look at depression, for example. Typically, a very small proportion of people with depression are under care. And this is a very good opportunity for the employer to think about how their EAP programs are working and what they're focused on. The second page of the report starts to give some cost information by chronic health condition. The total cost from the standpoint of productivity, both absence and performance or presenteeism. And then the second part of the exhibit, the distribution of how much of those costs are based on absence or performance. So it allows the employer to start thinking about impact of conditions that maybe they haven't thought about before. Most employers, when they think about chronic health, will go to their health plan and get information from the medical and pharmacy claims as the focal point of how they want to manage chronic health. But if the employee is not being treated for the condition, those conditions never show up in the medical and pharmacy claims database. Now, that means they're not driving medical costs, but they may be driving lost time and lost productivity. So this is a way to engage employers on a broader conversation around chronic health. And we often use this tool, and I think one of the most intriguing ways to use these models is actually with groups of employers, and to be able to run the model and then have a discussion with the employers about what they're seeing based on their model results. And the nice thing about model results is you're not giving any proprietary information away about the employer and their real experience. It is just to say, based on the characteristics of your company, here's what we're seeing. What are you doing in your disease management programs? What's your focus of your EAP programs? So we often will do this in groups of employers. and then create that roundtable discussion using the results as a way to generate a new conversation perhaps about chronic health, the kinds of information the employer should be looking for, and how to get information beyond the medical and pharmacy claims view. And a lot of employers are starting to build these things into their health risk assessments, for example, or other employee surveys to get a better idea of what's going on in chronic health in their workforce. And the last page simply gives, by chronic health condition, the detailed breakdowns, the percent of the workforce expected with a condition, treatment, number of chronic health conditions, et cetera, absence and performance. So it is a way to engage employers in a broader conversation, again, without having to invest a lot of time and money. So as employers focus on population health management and trying to extend and expand their view, these kinds of tools can provide information to help the employer think about what they should look for. And in particular, and I think perhaps most importantly, what kind of data and what metrics they need to be thinking about bringing into their conversation in their own organizations. The other part of the chronic health side is the employers that say, well, I've seen the model, but now I really want to find out what it looks like in my own company. And this is where the measurement side of this comes in. And so, as I mentioned earlier, we have a partnership with Ron Kessler at Harvard. We've taken his Health and Work Performance Questionnaire, the HPQ, which is one of the research-validated questionnaires, and we've streamlined it into a smaller instrument. So when a user, a member, wants to work with us directly in the measurement side, they'll click here, and it sends us an email. And what this does, and we work with employers really in two ways. Oftentimes, employers want to survey their employees directly on these issues, so we work with them to do that. We've got a data partner that actually does the survey work. But most often, the employer will want to build these questions. There's a core set of questions. They want to build them into their HRA, and we will work with the employer and their HRA vendor to do that. But it is the next step in the conversation about actually measuring for the employer and their workforce. Of course, different than a model, but once the model shows something of interest, then the next question is to the employer, do you want to start measuring these dimensions in your own workforce? And then finally, that last piece, which is, what does health really mean to my business? And I'm getting questions from the CFO about, should we stay in, should we get out? All I really know is maybe my health care costs. I have this sense that maybe this is not the whole picture from the standpoint of health. And so the last tool, the modeling tool, is that question of what does health mean to my business? And we developed this modeling tool, the full cost estimator, to do that. So again, back to the website, full cost estimator page, gives the overview, has instructions, methodology, right there online. And here's the data piece. So essentially, beyond what you saw in the data required for the snapshot, this is the additional data that we ask for the full cost estimator around lost time programs, wage replacement rates, and information on workers' comp. Now, to run the FCE, we don't need this information. Again, we can just use industry and number of employees to generate this and essentially say to the employer, for an employer of your size in your industry, here's what we would expect to see. But again, the more detail we can get on the employer and their programs, enrollment, wage replacement rates, and the like, the better job we can do of generating these estimates. And when this works essentially the same way as a snapshot. We get the data, we run the models, we generate the report, and then we provide the report back to our member and their client, and then we get on the phone and spend time kind of going through the report and answering questions. But you can see kind of the large view that the report generates. So we look at the full costs group health, performance or presenteeism, productivity, sick days, workers' comp, the whole gamut, and then we show the distribution. And in this case, medical and pharmacy costs are a little less than half of the total costs around health because of the impact of wage replacement and productivity. So it's a way for the employer to start to think perhaps differently about their health management programs, certainly about the outcomes they want to track, to really focus on the total health of the population and total impact. And then down here we get into the details, wage replacements, lost productivity, the medical and the pharmacy piece by program. So it's modeled, but again, it's a way for the employer to see the broader view and even start to bring in their own data when they actually know what these dimensions are, so they can kind of build it themselves, if you will, once they have the model results to start with. The second page of that report gets into the lost work time issues. What we find is presenteeism, that reduced performance at work, and we translate it into actually lost time, tends to be the biggest driver of lost time because lack of performance at work around health happens every day, and that's why it adds up, and that's why it tends to be a large number. And then we show sick days, days for family medical leave, etc. And then it's broken down in details, the total per FTE and the costs. We get into some of the disability outcomes in the report as well, but it's a way to, in a very short report, really see a very big picture around health. Now, the FCE, the full cost estimator, and the Snapshot are part of your membership. That is to say, there are no additional costs to working with us with these models and your clients. If your client actually worked with us to do a survey of employees, there are costs to that. But from the modeling standpoint, this is part of our relationship. And so we wanted to be able to do rather sophisticated modeling, but then be part of the conversation, because we fully appreciate, really on two dimensions. One, cutting across all these programs, people tend to have expertise maybe in one program but not others. But then secondly, to be able to answer questions about the underlying model and the data and all that, we feel that by being a part of that conversation, it really can help the employer and you, the partner, start to see these issues and then talk about what's next, particularly around the things the employer either isn't measuring or perhaps may have data in their organization they haven't brought together. So these two modeling tools are very effective ways to engage employers in that new conversation and lead to a discussion about what does it mean to your business. So that's kind of a quick overview of the tools. We certainly are available to do webinars and tutorials where we have a variety of more detailed explanations on the tools themselves. But I wanted to give an overview of what is available on this side of what IBI does. We also have our research available in our employer case studies and the like. But what we find is this is where the rubber hits the road. This is where there are the opportunities for real client engagement. I think we found that research is very helpful when a client wants to know about something, how do health risks impact medical costs or lost work time or whatever. And research literature is very helpful for that. But I think we find it's really important to take the next step and help an employer understand what these things might mean to them in their kind of business. And that's what we built these tools to do, is to really focus that conversation with an employer around what are these broader dimensions actually are likely to look like for your company. And now what are the things that you should do in order to really start to understand the full impact and get your data and track the right things and really do a better job of managing the healthier workforce, in particular better understanding the full impact of the interventions and the programs that you have in place. So with that, I'd be happy to answer any questions. If you don't have a user ID and password as of yet, or you have colleagues that don't, you can certainly shoot me an email and I'll have one of my staff set it up. We're here to really assist you folks in your work with clients around these issues. I will also say that you can sponsor any employer that you work with to be an IBI employer member at no cost to you or to the employer. And that simply allows us to help employers better understand these issues, start asking perhaps a different set of questions, and have IBI be that independent research, data, objective voice from the outside, helping employers really start to think differently about health and health outcomes.